March is Colorectal Cancer Awareness Month, and it's an important reminder that early detection can truly save lives. Joining us is Deanna Padilla, a nurse practitioner with Omni Family Health, to help sort of break down why screening matters, even when you feel perfectly healthy, and to talk about options like the Cologuard at-home test. We'll also cover who should be getting screened, what happens if a test comes back positive, and how taking action early can make all the difference in the world. Okay, March is Colorectal Cancer Month. How early detection, how does that save us?
Sure, well, early detection is a game changer. We have found that patients that have a small polyp that's found early and it's treated early, they have over the 5-year span a more than 90% survival rate. And again, that's if it's caught early.
Right.
Right, it usually starts as a small polyp or something that has no symptoms at all until that disease is much farther along.
Yeah. Okay, is this something, I mean, obviously, I don't feel a polyp. So is it something when you just go in for your regular physical that your doctor should be doing? And if it's not, should you say, hey, shouldn't we check for, for colorectal cancer?
Right, exactly. So there are certain ages and guidelines where we look for this test. Generally, if you're 45, it's time. It used to be when you're age 50, but we're finding that more and more younger adults are being screened for colon cancer because they're having positive tests.
Yeah. A lot of us, especially guys, don't like to go through certain tests, and we don't want to, deal with certain things. Is there an alternative to what's normally been done to check for colorectal cancer?
Right, so the gold standard, which you're probably used to hearing about, is the colonoscopy, of course.
Yes.
It is a great test. It is still the gold standard. We still recommend that, of course, and there are certain patients that should only get that. But there are more options now. Technology has come a long way. One of my favorite tests to order for patients is the Cologuard test. It's an at-home test. It's non-invasive, so that means that you're doing it in the privacy of your own home. It's just a stool sample. You're not doing any prep, so no more a day of drinking the medicine that makes you do that, and so no liquid diets, anything like that. You receive a kit at home in a discreet box that has nothing on the outside of it. You do your stool sample and you mail it back, and then I get the results.
I will admit I did the Cologuard test the last time I did it.
Was it easy?
It was incredibly easy. The only problem I had with it was I procrastinated. I didn't do it immediately, and Cologuard will stay on your rear to make sure, no pun intended, but they will keep after you to make sure you're doing the test so that people like you can look at it and see if there's a problem.
Exactly.
So, but as far as taking the test, it's something we do every day, so it's a very easy function. It
is, and it lasts the test results are good for 3 years, so you're not having to do it yearly, so we'll check that again in 3 more years.
That's even better.
Yeah.
So who's a good candidate for the Cologuard?
So again, anybody age 45 or older, it's time to start talking to your doctor about colorectal cancer screening, but good candidates are going to be patients that are of average risk. So our higher risk patients are those that have had a first-degree family member with colon cancer, so mom, dad, sister, brother. You're not a good candidate anymore. You still really need that colonoscopy. Or if you're having symptoms or a history of things like IBS, diverticulitis, ulcerative colitis, those are higher risk patients that are a better candidate for colonoscopy. Everyone else is average risk, and they can do a Cologuard at home.
So you can tell by looking at me, I'm just over 45.
Yes.
Well, let's go with that.
I had a feeling.
But as you get older, should the test become more prominent? Should you do it more often, or is it still that sort of every 3 years is still good for somebody, say, my age?
Sure, average risk, you still can do the Cologuard test every 3 years. It's not just looking for microscopic blood like some of the tests. Cologuard actually looks for DNA markers, so it's very accurate and very trustworthy, and we still just do every 3.
Okay, I freak out when I get a positive result from any medical test. But if somebody gets a positive result, then what's the next step?
So I think it's important to know that a positive Cologuard is not a diagnosis of colorectal cancer, but it is kind of a red flag. It's that check engine light. It means you need to get checked, So your next step is going to be a colonoscopy. Yeah. And we don't want you to wait very long to do that, because remember, these polyps, they start small and they're usually easy to treat when they're small. And if you wait a long time, you're just giving it a chance to grow into something bigger and potentially more dangerous.
And we're talking about life-saving here. So what's the one message you want to make sure everybody picks up from this?
I think the main message I have is don't wait. Don't wait until you have symptoms. The best time to find a problem for this is when you feel perfectly fine. So come in and get screened. Talk to us about which option might be best for you, because screening is easy and it could quite literally save your life.
Yeah. Now, if people need more information, about Cologuard, about about Omni, where do we go?
Sure, you can pop into one of our health centers. We've got 38 health centers across the counties. Come into Omni Family Health and talk to us. We will talk to you about screening options, which test is right for you. You can visit us online at omnifamilyhealth.org or give us a call.
And real quick roundup, how young should you start?
Age 45 and up.
Okay. Hey, listen, thanks so much for being here today on a very serious topic. We will be right back.